So as I mentioned, could you please describe Samter's triad, maybe talk about the prevalence, thinking about its mechanisms, and how often it presents the clinician? Because later on, we're then going to hear from our patient advocate, and I would like them to go into more discussion of the treatment.
Sure. So Samter's triad, as it sounds, or aspirin-exacerbated respiratory disease, consists of three main things. So it's asthma, chronic rhinosinusitis, which is basically nasal symptoms and sinus symptoms, and nasal polyposis. That's nasal tissue growth polyps in the nose. It is a disease or a collection of diseases, if you will, that really appears in adulthood. It's not something we tend to see in kids. It's very rare. That doesn't mean it can't be, but it's primarily in adults. And it tends to sort of start to developing around the 30-year age range when people get in their 30s or so. Usually it starts with sort of having nasal symptoms or rhinitis, and then it goes on to have asthma that's usually pretty difficult to control and can be quite severe. And patients that have the Samter's triad or AERD often require surgeries for the nasal polyps as well. In general, we see AERD in about 7% of adults that have asthma. But if you looked at adults that had severe asthma, it's really about twice that, about 14%. And if you were to take sort of all comers with chronic rhinosinusitis, so that's the nasal and sinus disease with nasal polyps, about 16% of them would actually have AERD, or this aspirin-exacerbated respiratory disease. In terms of what it actually is, I would let the patient sort of tell you a little bit what she's experienced, but in general, these people have sort of severe asthma, severe nasal and sinus issues. If they happen to take aspirin or a COX-1, and so there's different types of enzymes called COX-1 and COX-2 that people use, and COX-1 is sort of aspirin, ibuprofen, those kind of medications. If they take one of those, they can have symptoms within 20 minutes to 3 hours afterwards that can lead to a very severe asthma attack, very severe sinus situations as well. Not usually fatal, but they could be fatal as well. And so that's really sort of the disease. In terms of what happens and how that develops, well, it's related to this overproduction of these mediators called leukotrienes. At least we believe that's what it is. And so you get elevated levels of leukotrienes, and these COX-1 inhibitors like aspirin actually cause some shunting and increase the amount of leukotrienes. There's also a reduction in sort of things that block the leukotrienes, prostacyclins, lipoxins, things like that. And that's why we believe this is what leads to this aspirin-exacerbated respiratory disease. I could talk a little bit later about treatment. We won't get into that right at this point, but that's sort of what drives it. One interesting thing I would put out there, and I don't know if your patient here has had the similar symptoms, but often there's been studies that have shown that up to about 80% of people that have AERD actually have symptoms when they have alcoholic beverages as well. That can actually lead to a worsening of their nasal symptoms and things like that, which is kind of an interesting correlation.
Well, that certainly is a great background to get us started. So now I'd like to turn to our patient, the patient's voice on this condition. And we have our patient advocate, Rhonda Nelson. She's here with her husband, Wayne Nelson. Rhonda Nelson is a passionate advocate for those who are suffering from AERD. She's spreading awareness and empowering them to find the treatment they need. She serves on the executive board with the Asthma and Allergy Network and speaks nationally. In addition, she is a voice in the foster care system and serves on the Foster Care Review Board, advocating for children, adoptive and biological parents, as well as encouraging women to reinvent themselves in different stages of their life. Now, this varied background and her marriage prompted her to author the book, A Different Life, in which she pulls back the curtain on celebrity life on the road with her husband, Wayne Nelson, who is an international recording artist with the Little River Band. I want to thank you both for being here today.
Our pleasure.
Thank you. Thank you so much for having us.
So, Rhonda, let's start out with maybe telling us what were the symptoms, how did they first emerge when you were suggested to possibly have AERD?
So in 2000, I initially started out with what I thought was a basic cold. Because I wasn't in my hometown at that time, I also thought this possibly could be seasonal allergies just from the area that I was in. However, upon returning home, the symptoms lingered and they continued to get worse and worse and worse. Multiple visits to various doctors proved to be to not shed any light on what was going on, but we knew something was going on because this was lingering. And I really struggled to find a physician that would understand or could understand what my situation was, because at the time there were many physicians that weren't cued into looking for an atypical disease such as AERD as a primary diagnosis.
And how long from that year 2000 till you were ultimately diagnosed, would you say?
So the process was a little over 2 years. In 2002, we were living in North Carolina, and I was referred to an allergist. After he heard about my journey that had been going on for the previous 2 years, he immediately recognized the possibility of me having AERD. And ironically, he had just returned to North Carolina from Denver and National Jewish, where he had been in a conference that had a heavy focus on AERD. So receiving this diagnosis meant that we could finally get on a path of meds that would really allow me to have control of the disease and for it to be well maintained.
Very good. And is it after this experience that you decided to become a patient advocate for this condition and work with the Asthma and Allergy Network?
One way to create change and awareness is by working with a national organization. And that's why I became involved with AAN. But I also knew that I wanted to be an advocate for AERD because I knew throughout my whole entire journey that I couldn't be the only person that, one, had AERD, two, was struggling to get a diagnosis with AERD, and three, to find physicians who were well acquainted with the disease and with the protocol that would allow me to have a well-maintained disease.
So it sounds like, the impact of this delayed diagnosis was significant in your case. And luckily you found a physician at the right time who had been to the right conference to get you on a good regimen. And